In the second part of the video, I am going to be demonstrating my skills of medication administration with IM injections. And also, first, I would like to start with saying that my syringe selections for intramuscular injections is going to be from 1 to 3 mLs, and my syringe selection is going to be from 1 to 3 inches, and my gauge is going to be from 20 to 25. The size that I can apply an intramuscular injection is going to be my deltoid, my ventricular, and my vastus lateralis. I'll be demonstrating that in just a little bit. Now, I am going to retake back the medication administration like if I was on the bedside of my patient. So I'm going to redo my third check of this medication, and then I am going to administer. So here we go. So first, I am going to start by washing my hands. Alright, Mr. White. Your second medication for 9 a.m. right now in the morning, it's going to be Pneumovax, which is going to be given to you at 9 a.m. This is an intramuscular injection, and this medication helps your body to create your own antibodies, and this is going to help to prevent meningitis and pneumonia. Also, you have to be aware that there's side effects with this medication. It can be bronchospasm, which is shortness of breath. It can be can you call them?
Yeah.
In the second video, I am going to be demonstrating my skills for medication administration for intramuscular injections, IM injections. So first, I would like to say that for this kind of injections, the syringe selection is going to be from 1 to 3 mLs. And then my needle selection is going to be 20 to 25 gauge and from 1 to 3 inches. So first, I'm going to start by washing my hands. And I will be putting a set of gloves. So, if I was at the bedside with my patient, I'll be explaining him that this medication, which is Pneumovax, it's a Pneumovax vaccine. This is going to help his body, Mr. White's body, to create his own antibodies, preventing him and helping him to not develop pneumonia or meningitis. I will teach him and explain him that it is really important to be aware to not be drinking alcohol or smoking, and there are certain side effects like bronchospasm, which is shortness of breath. So I'm going to start. I'll be pulling off my mark, and I will be doing again my third check of this medication at the bedside with my patient. So I have Mr. White Cleveland. I have the right individual. I have checked allergies. He has allergies to penicillin. And the medication I need to be given is Pneumovax. It's an IM injection. IM injection. The time to be given is 0900. It's 0900, 9 a.m. And the expiration date is November 2021. So this is my third check of this medication before to be given to my patient. I already have at the bedside all the tools that I need. I have my alcohol pads, and I have my syringe and my medication. I have my gloves on. I have to draw 0.5 milliliters of this medication. So first, I am going to draw air. So I just draw some air. Now I am going to open it. Always be careful. Grab it like a dart. Put it in. Just a tip. I'm gonna drop back the air in. Then I'm gonna hold it. And I'm gonna draw 0.5 milliliters. I gotta make sure that I have the less air possible. We don't want any air or bubbles to go inside the patient. So here, 0.5 milliliters. Now I am going to take it back, and I'm going to put it back in the cab to get my patient ready for his injection. So first, I'm going to clip my area from inside out. I do not want to go back in. Now that is really clear. I'm going to tuck my skin. I'm going to pull it as much as I can. And I'm going to grab my needle, tucking my elbow in. It's a dart motion. I'm going to do. I'm going to go up, draw the medication in, count 2 seconds, 1, 2, needle out, safety, and we are going to dispose it. After doing that, I'm going to take off my gloves, dispose them, and finally I'm going to wash my hands again. And I am going to document that I gave this medication. So I am going to go in the box of Pneumovax 5 milliliters. I'm going to go to today's date. I'm going to state as given. Put down my initials. AGC. Time given. And the date. It's ready with black ink. So we'll be documenting, and after that I will put my patients, I'll do my big crowd, I'll put my bed patients down, the rows up, and we'll open my curtains. I'm gonna give them the cold bell light just in case they need something. I already documented it, I washed my hands, and I'll be stepping out of the room. Now I'm gonna demonstrate the different sites for the intramuscular injection. I have a syringe, it doesn't have a needle. So the first site I'm gonna be demonstrating, it's the deltoid. So we can locate our acromion process. Then we're gonna do 2 fingers down. We're gonna put our finger there. And there it's the side where we can give the injection. We will tuck a skin here. And all this area is the area we can give the injection. Now that we know, we will grab our syringe, ready. We'll tuck our skin as much as we can. And it's going to be straight. And that will be it. The second side we have, it's the ventrogluteal. So for this side, what we have to do, it's we always want to use the contrary hand of the leg that is the patient's that we're using. So in this case, it's his left hand, so I'm going to use my right hand. I'm going to locate his iliac spine. And then I'm going to come in my index finger there. My thumb is going to be pointing his pelvic area. And right here in the muscle, it's where I want to give my injection. Once I know my location, I have my syringe ready. I will grab it. Skin. Seconds and done. And lastly, the third side will be our vastus lateralis. We're gonna identify our graded truncator, and just right above your knee, you're gonna place your hands. Right here. All the space that it's in between my hands is the space I can be given the injections. In this case, it's gonna be right here. Once I know, again, I'll have my medication ready. Grab my skin, tuck. It can be in a 90-degree angle, or if the person is really skinny, it can be in a 45-degree angle. And those will be the sides for the intramuscular injection. Thank you.